renin, angiotensin, aldosterone, axis or system. Renin, angiotensin, renin, angiotensin, aldosterone system, what you call as a RAAS system or axis. If you take the axis, it will be R triple A. R triple A. For example, if there is, let's suppose, decrease in arterial pressure, decrease in arterial pressure, by any causes. For example, it might be the blood loss by trauma, or fluid loss by diarrhea, vomiting, and by any other mechanism. If arterial pressure is decreased, then body's feedback mechanism what will do? It will try to return the arterial pressure again normal. By mechanism, it will stimulate juxtaglomerular apparatus. From this apparatus, the special cells called juxtaglomerular cells, JG cells, it will secrete, it will release from the kidney, it will release the renin. Renin secretion. What this renin will do? Now this renin will through the blood stream go to the liver, there is angiotensinogen. Angiotensinogen is converted into angiotensin 1 by this renin in the liver. Now question arises here about this renin. In GI or endocrinology, you must have encountered this renin, this term also, double N IN, renin also. Remember, this renin is purely enzyme. But confliction arises here. This renin, some authorities believe this is hormone because it is released in the kidney and transported through the blood stream to distant site for its action, and some authorities believe this is an enzyme since it is catalyzing the angiotensinogen substrate into product, so some authorities believe this is enzyme. So at somehow either of the authorities are correct, because by some features, characters, it resembles as hormone, but functionally, as you see here, functionally it is enzyme. Hence you can categorize this renin as both hormone and enzyme. Hence, it has dual role. It has dual role. But remember, functionally, it is enzyme. So better term is used about this renin is enzyme. I will suggest enzyme. This is enzyme because it is catalyzing the biochemical reaction. It is catalyzing the biochemical reaction that are catalyzed by the enzymes. So angiotensin 1, now this angiotensin 1 will converted into angiotensin 2. Angiotensin 2 in the lungs by the enzyme called angiotensin converting enzyme, AC, angiotensin converting enzyme. And now this angiotensin 2 by multiple pathways tries to return this arterial pressure normal, towards normal. How? Let's see. This angiotensin 2 is a potent vasodilator, so it will constrict potent vasodilator, potent vasoconstrictor, so it will lead to constrictions of the blood vessels, constriction of blood vessels, mainly arterioles. It will constrict the arterioles and increase the peripheral resistance, and that will lead to the increase or rise in the blood pressure, towards normal. These angiotensin 2 have some intrinsic activity at renal distal convoluted tubule, left distal convoluted tubule, and by some intrinsic mechanism it will retain salt and water, sodium and water, as like aldosterone, retain salt and water and increase the plasma or extracellular fluid volume. Not only it does so, but the main salt and water retaining hormone is aldosterone. So what it will do? It will stimulate the zona glomerulosa of the adrenal gland or suprarenal gland, and that will lead to the secretion of the increase secretion of aldosterone, and then what this aldosterone will do? This aldosterone will retain salt and water in distal convoluted tubule. This will also do, it stimulate the hypothalamus and stimulate the other sympathetic actions that will lead to the increase in the blood pressure or arterial pressure. So major, it will increase secretion of ADH. ADH secretion will increase, and this ADH will will form the aquaporins, will uh, like let's suppose this is collecting duct of the nephron. So this collecting duct and this is inner medullary interstitium which is hyperosmotic. What it will do, it will pour here channels, water channels, that is you call aquaporins, and this aquaporins, through this aquaporins osmosis occur, and from this duct or tubule water is retained in the extracellular fluid. Not only it will do that, it will also degrade the there is one important potent vasodilator. Since it is increasing the blood pressure, then it will also tend to decrease the or reduce the factor that is causing the vasodilatation. I forget name here. If I remember, I will mention the name. Degrade the vasodilator, potent vasodilator. Yes, it is bradykinin. Besides other function, this bradykinin is potent vasodilator, and it will dilate the blood vessels and oppose the action of this RAAS mechanism. So this angiotensin 2 also degrade this bradykinin and prevent that opposing action. So by these all mechanism, body is doing is that increasing the arterial pressure towards normal by all these mechanisms. And these angiotensin 2 will also stimulate the thirst center in the hypothalamus, and if there is excess of water or fluids, the person can take the fluid or water and rehydrate him or her. So by all these mechanisms, the arterial pressure is returned towards the normal by this renin angiotensin aldosterone mechanism. And this is the one important example of negative feedback mechanism. Why I took this example? Because there are many other examples also. Why I took this example? Because this, besides this feedback mechanism homeostasis, RAAS, this system will also is important in the long term maintenance of the blood pressure, that you will be studying in cardiovascular block. So this is important there also. And again, if you want, you can relate here pharmacology also. This since we have talked about the antihypertensive drugs, then antihypertensive drugs that will act on this RAAS system, at what point they can inhibit this mechanism. If there is excessive, this function is aggravating or excessive, that will lead to increased blood volume and blood pressure, and ultimately that will be going to form the edema. So to reduce that hypertension and edema by this mechanism, you can use the drugs like renin inhibitor, direct renin inhibitor as L-screen, and here also this renin inhibition, and here also in this step also AC inhibitors. You know the AC inhibitors like enalapril, captopril, ramipril, perindopril, fosinopril, lisinopril. There are many examples. These drugs, what we will be doing? What we will be doing? Enalapril, captopril. What we will be doing? This will be inhibiting this angiotensin converting enzyme and again inhibiting this pathway. And the physiological molecule that will do all these functions, you can inhibit these molecules also as angiotensin receptor blockers, ARBs, angiotensin receptor blocker, that is AT1 receptor blockers. For example, losartan, valsartan, candesartan, many examples. Losartan, and you know the definition. The drug is any substance or product that is used or intended to be used to modify or explore the physiological systems or to change the pathological states. See, these drugs what are doing? Modifying this physiological system, physiological pathway. So drug is very easy if you know the normal physiology.